Hello and welcome. My name is Andrew Nyasu. Thanks for taking time to go through this self-training video on how you can use electronic medical record systems. This video is helpful for beginners and those who already use the system who just want to understand a few tricks on how you can manage to use the electronic medical systems. So, in this video we'll talk about the ART system, and we expect you to first of all understand the basic hardware involved in using the EMR and how to log in, how to register clients, consultation, and also drug dispensation using the system. Welcome back. In this video, we'll focus on the ART system, how you can manage clients at the ART clinic. So, from the first screen that you see, you have the national EMR username and your password. So, for you to enter your username, you press in the box written username and you get a keypad. There, you start typing your username. After that, you press next for you to enter your password. Then you type your password. After you enter your password, you press on the green button written login, and then you are presented with a screen saying scan workstation location. This workstation location indicates the section of the clinic where you're working from. So you scan that workstation location. Once you do that, you're presented with a set of modules which you can use at the clinic. You have ART, ANC, and OPD, depending on the number of systems that are deployed at the facility. So in this case, since you're interested in ART, we press on ART. And then after that, you're also presented with a set of activities that happen at the ART clinic. So depending on your role at the facility, you select the task that you do at the clinic. For example, you have vitals, where you can be able to capture the client's vitals, weight, height, BP, prescriptions. You can also give the client appointments. You can perform staging for the client and the other tasks that happen at ART. So in this instance, we'll select all activities and then you press finish. You do that and then you're presented with the application dashboard. This is the landing page which shows all the statistics for the facility. On the landing page there, as you can see on the top there, you have the name of the facility. There you also have the location where you're working from at the facility. You also have the date, which is in green, showing that that's the current date when you're working. And the user, that's the username that we use to log in into the system. And on the middle there, we have three buttons: Overview, Reports, and Administration. On Overview, you get to see the statistics for the clinic for the day on the right there. And also on the left there, you get the statistics of the number of complete and incomplete visits for the last 5 days. On the second button there, you have Reports. You press on that, you're presented with the different reports that you can run with the EMR. On Administration, once you press on Administration, you are presented with all the administrative tasks that you can do in the system. So we'll go back to Overview. And at the bottom of your screen, you have some 4 buttons. The first button there is the Logout button, which you use once you've completed using the system and you're knocking off. You click on Logout and it ends your session. And you have 3 more buttons down there. The first one is Find By. That's the button we use that when we're trying to search for a client using the client's ARV number. Find or Register Patient, the green button, that's the button that you use when you're trying to find a client using the client's first name, surname, and the gender. And also, we have the button there for applications which you can use to switch between applications. On the middle there, as we can see on the right, where encounters created 30 July as of today, you have all encounters that the client can go through at the clinic. They are disaggregated according to gender and added as a total for the whole facility. So meaning currently today, we have only done registration for one client who was male, reception 1 who was also male, vitals 1, staging 1, consultation 1, and all the other tasks we've only done for one client. So as the day goes by, these numbers will increase based on the number of clients that you have seen. Now we'll walk through the process of registering a client for the first time at the ART clinic. So for you to register a client, you first press the green button, Find or Register Patient. After that, you're presented with a screen that allows you to capture the client's first name. So you type the client's first name. Once you type that, you press Next. You enter the client's last name. And then you press Next. And then the system will ask you for the client's gender. Now, let's say this client is female. And then you press Finish. After that, the system will search in the database to see if there's another client with the same first name, the same surname, and the same gender. But from the screen, as you can see, it shows 0 patients found, meaning there's nobody matching that same client's information. So you press on Create a New Person with the name Test Client, and you notice the green button down there changes to New Patient. So when you press New Patient, it now continues to capture the client's demographics. So now it will try to find the client's age. So it will ask you to enter the client's year of birth. So you put the client's year of birth, and then you press Next. It will ask for the month. Let's say the client was born in May, and the date in May. Let's say 25 May. You click Next. Then it will ask for the client's region of origin. So let's assume this client is from the southern region, Mulanje. So we go to southern region, and then you select the district, say Mulanje. You select the TA from Mulanje, let's say TA Chikungu, and the village. When you capture the region of origin, now the system will ask for the current region. Where is the client staying now? So let's assume the client stays in Lilongwe, which is in central region, Lilongwe City, say area 13, in the village area 13, and the closest landmark. So on the closest landmark, we have already some predefined landmarks, Catholic Church, CCP, but sometimes the client may stay at a place that's not on one of the predefined lists. So you press on Other, and then you type the landmark. Say near area 3 river. So you do that, you press Next. You capture the client's cell phone number if the client has a phone number. If the client doesn't have a number, you put Not Available or Unknown. And then the type of patient. So there are 2 types of patients, either a new patient or external consultation. For a new client, this is a patient who is either the first time or a transfer in, while for external consultation, these are clients who are not trying to register at the clinic, but they simply just want to top up on the drugs that they have. So in this case, since this is a client that we want to register at the facility, so press New Patient, and then you go Next. And then you are asked if you want to register the client's guardian, but in this case, we'll just skip that one. We'll say we are not registering the guardian yet. And then you get a summary of the client's demographics, which gives you the client's first name, the client's surname, the gender, the date of birth, the home district, and the current district, including information like the client's cell phone number and the type of patient, whether the client is a new patient or an external consultation. So once you cross-check this information to be correct, you press Finish. The system will now print a barcode, the national ID barcode, which you take and you paste on the client's health passport and on the client's MasterCard. So now you start the HIV reception task, where you now start inquiring from the client if the client is willing for follow-up, whether to be visited at home or to be contacted via phone number. So if the client says yes, they can be contacted by phone. and is willing to have some home visits, you say yes. After that, next. And then the system will inquire from the client if the client has ever received ARVs for treatment or prophylaxis. Now, this question is the one we use to differentiate between first-time clients and transfer-in clients. If a client is transfer-in, usually it means they were receiving ARVs from another clinic. So in this case, we say yes. But if this is a newly diagnosed HIV positive client, it means this client was not taking ARVs, so we say no. So for first-time clients, we say no. For transfer-ins, we say yes. So we say no. Confirmatory HIV test. You select the type of confirmatory HIV test that the client did, and then it will ask you for the location where this client did the confirmatory test. So usually you get the name of the current facility on top. But if the client did a confirmatory test at another clinic rather than where you're registering this client, you just press clear and you get a complete list of all the facilities that are available. So since currently we're assuming that this clinic is Martin Place, so we just said that. And then confirmatory test year, you need to specify the date when this client did the confirmatory test. So let's assume the client did the confirmatory test today on 30th July. So test year will be 2019. Month will be July. Test day will be 30. After that, the system will now inquire if the client is present and also the guardian is present. So we say the patient is present, yes. The guardian, no. Since we said we are not registering the client, we are not registering the guardian. And then you press next. After that, the system will ask you to capture the client's ARV number. So we'll say yes. The system already provides ARV numbers within the required sequence. So in this case, it has given ARV number 3. So if this number matches the one that's in the register, you will maintain it. So next, the system will check if the client is already taking drugs for blood pressure. We'll say no. After that, you're now given the screen to capture the client's vitals. So from the screen, as you can see, with the kind of vitals that we capture, we have the client's weight, client's height, the client's BP, temperature, oxygen saturation, and the client's pulse rate. And on the middle there, we have the keypad that we use to capture the values for the vitals. And on the far right there, we have each vital sign and the values that have been entered accordingly. So right now, as you can see, all other vitals are in blue except for weight, which is in white, meaning if I type something on the keypad there, it will enter that value on the weight. To capture height, we press height. You notice now height will be white, the other vital signs will still be blue. If I now enter the height, it will indicate on the section for the height. And the system automatically captures the client's BMI and categorizes it accordingly. So let's assume this client will only measure the client's weight and height, and then we press finish. Since the client is female, the system will ask if the client is pregnant or breastfeeding. In this case, let's assume the client is not pregnant and is not breastfeeding. We press next. It now gives you a summary of the client's weight history. Now, since this is the first time for the client to have the vitals, the client's weight recorded in the system, you notice on previous weight, it's blank. Latest weight shows 56. The client's weight, age, and the client's BMI. The next time this client comes to the clinic, another small dot will appear there, depending on the height, and it will join a line so that you can actually monitor the client's weight if it's going up or down or being maintained. So after that, you press next. You're now into the staging section, where you have to indicate the start reason for the client. So in this case, let's assume this client the start reason is stage 1, asymptomatic. So the system will start with stage 4 and provide you with all the conditions for stage 4. You press next. You're given stage 3 conditions. For example, severe weight loss, diarrhea, chronic diarrhea which is more than a month, fever, persistent, unexplained, all those conditions. You press next. You get stage 2 conditions. You press next. You also get stage 1 conditions. So you have to select either from stage 4, 3, 2, or 1. So in this case, let's assume the client was asymptomatic. You press on asymptomatic. You press next. System will still ask you if for any recent CD4 count results. This client doesn't have any, so we just say no. You press next, and then you get a summary of the staging. So for this client, the stage, the WHO stage is stage 1 adults. Condition on starting ART, asymptomatic. You press finish. It means now you're done with the staging, and now you're going to the clinical consultation. This screen here presents you with the lab orders, mostly the viral results. So for this case, this client has no results since this is the first time to register the client. Now let's assume we want to capture the VL results for this client. You press on this blue button written order. You press order. You're presented with the list of lab tests that you can conduct on the client. So you have that whole list: CD4, calcium, cell count. So they're arranged alphabetically. So since we're looking for viral load, it must be at the bottom. So you scroll down till you reach viral load. So you press viral load. Main reason for the test: is it a routine test, a targeted test, a confirmatory test, or repeat or missing? So in this case, let's just assume this is a targeted test. You press targeted, and then it will give you the summary there. Once you've done that, you just press order test, and the system will tell you that the order was successfully done. So once the results come, they will be appearing here. So now we proceed with the consultation. You just press next. Now, since the client is female, it will ask for what family planning method the client is on. Is the client currently on oral contraceptive pills, male condoms, female condoms, implants, whichever they. So you select the one the client is taking at the moment. So in this case, let's assume she's not currently taking any. So we say none of the above. You press next. Then the system will now ask you, what family planning method are you providing to the client today? So we say none of the above. So we're not providing any. The next screen will show you a list of all contraindications or side effects the client currently has. So this client, as you can see, is showing blank, meaning the client does not have any side effect. So we press next. And then for this consultation, you now assess for any side effects. So you ask the client, do they have any skin rash? Are they having insomnia and the like? So according to the responses, you say yes or no. So in this case, let's assume the client isn't showing any side effects. So select the no. And please note that here you have to select everything. In this case, I have not responded on insomnia or other. And when you press next, the system will refuse because each field has to be captured. So select no. And then while doing the consultation, the system will now do the TB assessment. It will ask first if the client is on TB treatment. So let's say this client is not on any TB treatment. We say no. And then we do the TB assessment to find any TB associated symptoms. First of all, it will ask us, does the client have any cough of any duration? Either yes or no. Does the client have a fever? Night sweats? No. Weight loss or failure to thrive? We say no. We press next. And then we'd ask for if the client is allergic to cotrimoxazole. We'll assume the client isn't. Then the system requests if the client needs to be referred to the clinician. Let's say no. Now, this is now the screen that you use to prescribe drugs to the client. So at ART, you can select whether you prescribe ARVs, CPT, or IPT. Or sometimes for that visit, if the client is not taking any drugs, you just say none of the above. But for this visit, we assume the client will be given ARVs and CPT. Press finish. Once you do that, then you are presented with all the ARV regimens. Now, take note, these regimens are usually based on the client's age, gender, and the weight. So this client current says the client is 35 years old, gender female, and the weight, age is 56, meaning she's eligible for any of these. So for this client, we will prescribe 5A. So for you to prescribe 5A, you just press on 5A. 5A gets highlighted, and then you press next. You're given a summary of the drugs that you prescribed. So there says you are giving cotrimoxazole, the 960 milligrams. In the morning, no drug is taken. In the afternoon, none. And 1 drug is taken in the evening. So the same with 5A. 0 tablets in the morning, 0 in the afternoon, 1 tablet in the evening. You press next, and then this is the window you use to prescribe interval to the next visit, meaning the drugs that you're giving the client, for how long will that client be taking. So we have 2 weeks, you have 1 month, you have 2 months, 3 months, 4 months, until 1 year. So let's say we're prescribing drugs for a month. So you press 1 month. Once you press 1 month, take note of what will happen here. It shows that the medication run out date. The drugs will run out on 27 August 2019. Estimated number of packs or tins, 1. If I say 2 months, you notice the date will change. So that will be 2 months from the current day. And the number of tins as well will change. So we maintain that we're giving the client drugs for a month. You press finish. Now this is the dispensation window, the window that you use to now give the client the drugs. So first section here, that's where the medication is. It lists the names of the drugs you're giving the client, amount needed, the amount you've dispensed, and the reset button which you use in case you've wrongly entered in case you've wrongly dispensed more or less drugs. So you can press that button to reset it back to 0. So for you to dispense, you need to press on the name of the drug there. So if you press there, it will now give you a dispensation window. So it says amount needed is 28, but in this case we'll prescribe 30 drugs. Since that that pack holds 30 drugs, and the 28 day means it's just counting the number of days to the next visit. So we just say 30, and then you dispense. Similar to cotrimoxazole, you press cotrimoxazole and you dispense. Once you do that, it automatically moves to the appointment booking window. You get this calendar there. From the right side of the screen, you notice that it says medication run out date is 28 August. But user appointment date is 26 August, meaning the client will come 2 days before the run out date, because we do not want the client to come on a date when the client doesn't have any more drugs. And from the 26, as you can see, appointments, it shows 0, meaning there's no one else booked on this day. If there are 2 other clients booked on this same day, it could have put 2 or any number of clients that have already been booked. And then here where it says appointment limit per day, this is where now the clinic can set that per day will be viewing this amount number of, will be seeing this number of clients on a specific day. So you can also adjust this date. For, let's say the client should come on Friday 23 instead of the 26, in case maybe you've overbooked, you can adjust the days accordingly. So we'll still just maintain the 26. Then you press finish. After that, the system will now print you a visit summary. And after the visit summary has been printed, you will now come to the patient dashboard, where it will now show information on the client, the name, the gender, usually seen by, if it's the image there is pink, shows the client is female. The client's birth date, where the client stays, and on the middle section there we have the ART start date, when the client starts, and the duration on ART. We also have the section there which has the client's ARV number and the client's current regimen and the client's outcome. As you can see, this client currently is on antiretrovirals. And on the middle section there, you have these two sections. The first section shows you the number of visits the client has had. So currently, since we've just registered this client for the first time, it shows one visit, which is for 30 July 2019. And on the other section here, you get 4 tabs. The first tab will show you the activities that happened on this specific date. Any alerts this client has, alerts like any side effects, or in case the client has a bad BMI. And then you have this section for lab orders where you can view the client's VL results, and also the medication tab here where you can see the medications this client has been prescribed and dispensed. So if you press on any one of these, you get to view more information on that section. So for example, we'll try to click on the activities. You press activities, you now get to see all those activities that we did for the client on 30 July. If you press registration, it will tell you that the registration type, the client was a new patient. You press registration, it will tell you that all that information that we entered, the client on that question, whether the client had registered to another clinic, no, when the confirmatory test was done and where it was done, the client's vitals. Once you press on vitals, you get to see the client's weight, the client's height, the client's BMI. You get to see the client's staging. So you can just press on any one of these to see what activities and responses the client gave for each task. You can press close, it closes that window. So once you're done with the client there, you can just press finish, and it will take you back to the application dashboard. So as you can see now, we have 1 female and 1 male. In total, we have seen 2 clients for the day. I hope you're following. So soon we'll talk about how we can register a transfer in client, how we can update the client's outcome, maybe from on ARVs to transferred out to died or maybe stopped. But if you can get it right for the first time, don't worry and don't feel bad about it. Just go through it again and again, and you soon be able to use the system well. So as I've mentioned at the beginning, once you're done using the system and you're knocking off, you can simply just log out, and the system will take you back to the login screen. Alright, welcome again to this video. In this video now, we'll walk through the process of registering a transfer in client. So we'll still walk through the same process, or you first of all have to log into the application. So you press on the username there, you type your username, then next you enter your password, and then you press login. System will ask you to enter your workstation location, which part of the facility you're working through. So you scan the workstation location which is provided on each computer, and then you select the system that you want to use. In this case, we're still using the ART system, so you press ART. You're presented with the tasks that you can do, so you select any of those, and then you press finish. So you're presented with the application dashboard once again, where the name of the facility, the location you're working from, the date, and the user ID we use to log into the system. So as usual, we still maintain the same process where currently, as you can see, we have 2 people registered into the system. Now we want to register a client who is a transfer in. So we still maintain the same process where you first click on find or register patient. You enter the client's first name, then you press next. Now that you enter the client's gender. So no patient found with the same first name, surname, and the gender. So you press create a new person with the name test again. New patient. So the system will ask you for the year of birth. Now sometimes some clients may not know the year day or month they were born, but they know how old they are. So in this case, on year of birth, you can press unknown, and then the age estimate of the client. So let's say this client believes to be 36 years old. You press next. You notice that you do not ask for the year, month, or day. And then the system will now move on to the client's region of origin. Where is this client from? So let's assume this client is now from the central region, from Kasungu, from TA Chilowa Madambe, village Chalinda. Current region, where is this client staying? So we say the client stays in the central region, in Chisi, TA Kalumo, in Chabuka village. The closest landmark. We say this client stays close to secondary school. And then next. The client's phone number. If the client has a phone, you put any valid phone number there. Now, type of patient. Remember, we're still registering a transfer in client, so we still maintain that type of patient, new patient, not external consultation. Please remember that external consultation, this is a client who's only coming to ask for a top-up of drugs or a refill, not necessary to be registered at the facility. So any client that's coming for to be registered at the client at the facility as a first time we transfer in, we still select new patient. To register guardian, we just skip that one. We say we are not registering guardian now. So it will give you a summary of the client's demographics. Client's first name, client's surname, the gender, date of birth, if the date of birth was estimated, the client's region of origin and the current region, and the client's phone number. You press finish. System will now print a barcode which can be stuck on the client's health passport and on the client's MasterCard. So after that, now the reception starts happening, where the system or the provider will ask the client if the client is willing to be visited at home or to be contacted via phone calls. So we assume the client says yes to both. You press next. Now the system will ask if the client has ever received ARVs for treatment or prophylaxis. So since this client we're saying is a transfer in, the belief is that from wherever the client is coming from, the client was taking drugs, was taking ARV drugs. So in this case, we'll say yes. So for transfer ins, ever received ARV treatments or prophylaxis, we say yes. For first time clients, it's no. So we select yes. So next it will ask year the drugs were last taken. Here it's just trying to find out when did the client last take ARV drugs. Please note that this question is not asking for when the client started taking drugs. So the assumption is if the client is coming today, since ARVs have to be taken every day, so we assume that this client took drugs yesterday. That is if the drugs were taken in the evening. So let's assume this client, when was asked when did you last take ARV drugs, says yesterday. So we say the year is 2019. Today is 30 July. So we say month last taken, July. Day last taken. We assume the client last took drugs yesterday, which was on 29. So the system now asks, has the client ever registered at an ART clinic? So since this client is a transfer in, the assumption is the client started taking drugs at another clinic. So we say yes. Location of ART initiation. Where was this client initiated? So once you get on this screen, you usually get the name of the facility where the system is at. So in case the client was initiated at a different facility, you press clear, and then you get a full list of all the facilities in the country. So let's assume this client is coming in from DHA Health Center. So you type in DHA, and the list will be filtering. And then you select DHA from the list. You say next. Year started. So when did the client start taking ARVs? So let's assume this client started taking the drugs in 2010. in January, 1 January. ART number at previous location. So we'll just assume the client's ARV number at previous location. Let's say it's NTJA. So let's assume this is the client's ARV number at the previous location. Then you press next. After this, the system will ask for the client's staging information at the time of initiation. So we'll say, since this client has come through with a transfer letter and documentation from the previous health facility, we'll say yes, and then you press next. So the first thing the system will ask there is the client's height. But please take note that this height is when the client started ART at the previous clinic, not today. So we assume after checking through the client's documentation, it says the client's height was 158 centimeters. You press next, and the client's weight, as again, this weight is for the time when the client was starting ART at the previous location, not at this facility. So we'll say that after going through the client's documentation, it says the client's weight was 52.4 kgs. And then you press next. It will now ask for the start reason, the client's staging. As usual, the system will start with stage 4 and present you with the stage 4 conditions. You press next, you get stage 3. So we'll assume the client's start reason was severe weight loss. You get stage 2. You get stage 1. And then if CD4 count is available, we say no. CD4 percent available, say no. And then we give you a summary of the client's start reason. So client is on stage 3 adult. Condition of starting ART, stage 3 adult. Stage defining condition was severe weight loss. And then you press next. Confirmatory HIV test. So you get this on the client's documentation or when the client was being tested. Location of HIV confirmatory test. As mentioned, you get a list of all facilities. So since we said this client is transferring from Ntaja, you can just type Ntaja. That's where the confirmatory test happened. So say Ntaja Health Center. The year the confirmatory test happened, we still maintain the 2010 January 1. That's when the confirmatory test happened, and that's the date when the client started taking ARV drugs. So now the system has captured information for the previous from the previous health facility where the client was initiated. So now for the reception today, is the patient present? Yes. Let's assume the client didn't come with a guardian. We'll say no. Now we need to provide this client with an ARV number that corresponds to this facility. So we say, do you want to capture ARV number? We say yes. So as usual, the system keeps track of all ARV numbers at the facility. So currently the free ARV number in the sequence is 4, and we assume that in the register it also corresponds to this 4. So we say ARV number 4. Then we proceed. Is the client already taking drugs for blood pressure? We say no. After consulting with the client, and then you go next. Next, it now captures the client's vitals for the day. As you can see there, the height has already been captured, since at 36 we don't expect this client to grow any taller. So you have the weight, the BP, the temperature, oxygen saturation, and the client's pulse rate. So we'll now capture the client's weight for today. Let's assume today's weight was found to be 60.2 kgs. And then you press finish. It will now request for lab orders. So if the client is due for vial load, you can order for the drugs. Because you can order for VL. But if the client is not yet due for any VL, you can just proceed and press next. And then it will show you a graph of the client's weight history. Remember when we said the client's was being initiated, the client's weight was 52.4 kgs, and today, that was on 1 January 2010, and today on 30 July, the client's weight is 60.2, meaning the client has gained weight, 15% more weight. So as you can see from the graph, it shows it's going up. You press next. You get a list of all side effects or contraindications the client has. Now, since this client has no past side effects, that's why it's blank. You press next. Today's consultation, you now start assessing if the client has any side effects. Kidney failure, skin rash, anemia, insomnia, psychosis. So depending on the responses the client gives you, it's either yes or no. Yes or no. So let's assume today this client does not have any side effect. Next system, while still maintaining the consultation, will ask if the client is on TB treatment. So we'll say the client currently is not on any TB treatment, but still TB assessment has to be done. So you ask questions that can find any TB associated symptoms, like does the client have any cough of any duration? So based on the response the client gives you, you select the response. Does the client have any fever? Does the client have any night sweats? Is the client losing weight or failing to thrive? So we proceed, say no. Next, system will ask if the client is allergic to cotrimoxazole. We'll say no. So if the client has any side effect or some allergies or anything that you've observed to be wrong, you refer the client to the clinician. In this case, the client is not exhibiting anything that may need intervention of the clinician, so we say no. Then we proceed. So next, the system will ask you, what medication are you prescribing on this visit? Are you providing ARVs? Will you provide CPT? Will you provide IPT? Or you are not giving any drugs? So for this visit, the client will be given ARVs and CPT. Then you press finish. After that, the system will now bring you a list of all ARV regimens that are available. As usual, it will still remind you of the client's age, the client's gender, and the client's weight. So this client was already taking 13A, so now we are providing the same 13A to this client. You select the 13A, you press next, you get a window here which just summarizes the medication that you have selected for the patient and the time of the day when this medication should be taken. First one is cotrimoxazole, 960 milligrams. In the morning, no drug is taken. At midday, none. In the evening, 1 drug. While for 13A, in the morning, 1 tablet. In the afternoon, no tablet is taken. In the evening, no tablet. So this window works as a reminder for the client what time the drugs should be taken. So we proceed, we press next. Interval to next visit. So this window just tells you how long the drugs will last that you've prescribed. So for this client, we'll say we're providing drugs for 3 months. 3 months from today, these drugs will run out on 22 October. And the number of tins for 3 months will be 3 packs or tins. So you press finish. Now you dispense. For 3 months, you're dispensing drugs for you're dispensing 90 tablets. So for you to dispense, you need to press the name of the drug, not the number, because if you press, you notice there won't be any reaction there. So you need to press on the name. You press there, you get a dispensation window. Remember, this screen reminds you, amount needed 84. Well, we'll be prescribing drugs for 3 months, that's 90 tablets. The same with cotrimoxazole, 90 tablets. Once you've done the dispensation, system automatically sends you to the appointment booking window. So as you can see here, it shows that medication will run out on 27 October, but the appointment has been set for 25 October, meaning it's giving a 2 days buffer for in case the client fails to come on the appointment date, and the client should not come on a visit on a day when the client has completely run out of drugs. And as you can see, on 25 October, it shows that there's one client booked on that day, meaning this client will now make it 2. So in case you want to reassign the appointment date, you can press on any other day there. But if you press on a day that's way above the medication run out date, it will give you a warning that medication run out on 27 October. Are you sure about this selected date? Because we are selecting that this client should come on 28, on a day when this client would not have drugs. So we'll just say no and maintain the correct date. You press finish. System will now print out a visit summary, and you get information there of the client's visit. So as you can see there, once you press 30 July, these are all the activities that happened on 30 July. You press there, you now get all the tasks that happened on 30 July. For registration, it will tell you this was a new patient, and the client was registered at another clinic in Taja Health Center. That's the previous ART number, the date the client last took the drugs, and all that information there. So once you're done with the client, you get to view there again the name of the client, the date of birth, the ARV number that has been assigned to the client's regimen, and all other information like the drugs that the client has been given, as you can see there, 13A. So once you're done with the client, you press finish. You get back to the dashboard. As you can see, the numbers now are increasing. Like today, so far, we've seen 3 clients. So once you're done with the clinic, you still log out of the system. Otherwise, when another client comes, you proceed with the same process where you find a registered patient. But now we've just registered a client with ARV number 3 or 4. Now for you to view that client, you can just go to find by ARV number. You put the ARV number. Let's say ARV number 4. You click next. You notice that it's the same client who we assigned ARV number 4 with the name text and surname again. You press continue, you get to the client's dashboard. So that's how you register a client who is a transfer in client who was initiated at another clinic and has just transferred it to your clinic. Alright, welcome again. In this video, we'll now walk through how we can update a client's outcome. Meaning, let's say a client has transferred out from your facility, the client has died, or the client has stopped taking drugs. So we'll walk you through the few steps that you have to have the client, like the client's ARV number or the client's name. So in this case, let's assume the client has transferred out, or the client has come through and is requesting for a transfer out. So when the client comes, you get the client's ARV number and you search for the client's profile in the system. So the first thing is you go at find by, that is if the client has come with the ARV number. If the client is not sure of the ARV number, you can use find a registered patient to search using the client's name. In this case, we'll try to use the ARV number. So you go to find by and you select ARV number there and then finish. So let's say the client that's trying to transfer out is ARV number 2. So you press 2 and next. Then it will bring you the client's profile. So this client's name was hello again. You verify with the client, and if it's that, if that's the correct account, you press continue. You're presented with the patient dashboard. Now, for you to update this client's outcome, as you can see currently it says this client is on antiretrovirals, meaning this client is still active at the facility. So for you to transfer out this client, you go at printouts or other. You press that, you're provided with these buttons, the menu buttons there. So you have national ID print, lab activity and all those, but for you to update the client's outcome, you go at programs. You select programs, you find the HIV program there. You press HIV program. it will now indicate the day when this client started ART. So for this client, says on antiretrovirals from 30 July 2019. Now for you to update this client's outcome, you press on this blue button down there written update state. You press update state. It now gives you the 3 states that the client can update to. Either the client has transferred out, the client has died, or the client has stopped treatment. In this case, we are saying we are transferring out this client, so we press on transferred out. So for transferred out, the next question will be, where is this client being transferred out to? In case we say the client has died or treatment has stopped, you just indicate the day when this client died or when the treatment stopped. So to proceed with transfer out, we'll press transferred out. Then next, it will now ask you to select the name of the facility where the client is transferring out to. So in this case, you just press clear and then you start typing. So let's assume this client is now transferring out to Malawi District Hospital. So you just type MULA to filter out and J. So we have all this Malawi District Health Office, Malawi District Hospital. So you select Malawi District Hospital and then next. So next it will ask when this client has transferred out. So we assume this client has transferred out today, 30 July 2019. 2019, month, July, day, 30. You press finish, system will let you that the outcome has been successfully updated. And when you press HIV program again, you now notice there's a new line that has been added there. Patient transferred out on 30 July. You press cancel there. You go back to the patient's dashboard. You now notice the outcome has changed to transferred out. If the client had died or treatment stopped, could have also indicated here that patient current outcome died or treatment stopped. So that's how you update a client's outcome using the EMR. So once you're done with that, you press finish and then you proceed with assisting other clients. Finally, we have come to end. I hope it was easy, but as I've said, you can go through this video over and over again. You can also catch us on our social media platforms. We are on LinkedIn, we are on Facebook, we're also on Twitter, and our website is also up and running now. You can also call 1200 using your TNM line for free to report a problem or to get clarity on something you did not understand in this video. The number again is 1200.